Hey there, if you're coming across this video for the first time, my name is Dr. Chafe. I'm a hair transplant surgeon and hair loss coach, and I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. I have a couple of questions here, and if your questions are not among the questions I'm going to address today, please send us an email, or comment down below, and I'm going to answer your questions in my next video. So you're going to see the questions reading right here, and as I'm going to read it. So the first question says, when do I start washing my hair after a hair transplant? I know there's some debate. Some doctors say 1 week, some say 15 days, some say 24 hours. But I want you to understand the concept. It's not about washing your hair, it's about what to do after 24 hours after your hair transplant. I always tell my clients dab, 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 or tap, 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 then scrub, scrub, scrub. What do I mean by tap, tap, tap? Means after 24 hours, you want to start spraying. Like after you get home, when you wake up, 12 hours, 24 hours, you start using the hairspray that was given to you or the shampoo that was given to you. You have to know how to mix the shampoo with water to spray on your hair, and you tap that area. Just simple tap, 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 tap to keep the area moist. Then after 1 week, it's safe to scrub your scalp. So it's not really about the timing, it's about knowing what to do. So if this is you, you're planning to go for a hair transplant and you don't know what to do, read your post-op instructions. If you've read your post-op instructions and you still don't know what to do, remember, tap, 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 and scrub, scrub, scrub. So my second question here says, I went for a hair transplant evaluation and I was given a quote based on size. Which is better, size or quote based on number of grafts? Now, this is a little bit tricky. Either one is okay, but in my clinic, we tend to do based on size or the area of hair loss. Why do I say that? Grafts can come in bundles. Imagine like a bundle of broom can come in 2, 3, 4 bundles. Okay. Now, in those bundles, they can be split into one or single hair, and they can use that especially for your front hairline. So imagine if they quote the number of grafts and they have to still split the grafts. So it's not really the number of grafts, it's more about the number of hair that is needed to cover the area of hair loss. So do you understand it? So that's why I try to let my clients know that it's not really about the grafts or the hair. It's about the area I'm about to cover up and how much do I need to cover the area. Okay? So I don't want you to get confused. I prefer area of hair loss, calculating area of hair loss, then I know how much I need to cover it. So we charge per area and not per graft. So if this is you going for a hair transplant, wondering which one is best for you, I promise you, it really doesn't matter, but I think is better to do area size or area of hair loss than quoting grafts, because sometimes you get deceived by telling you you're going to get this number of grafts, and that is a lie. So my third question here is, it says, what are the essentials you need for hair transplant? That means you've not been following me, or you're new here, or you haven't seen all my videos on YouTube. I mean, if you've gone to YouTube name is Dr. Chefu. I promise you, all these videos are on YouTube. Essentials, number one, you have to have your pre-op instructions. That's number one essential. Everything you need, all the questions that you have will be answered. Now, let's say you've misplaced your pre-op instructions. What will I recommend? Number one, make sure you have your hair loss medication. You're taking it. Even after your hair transplant procedure, please don't stop taking your medication. Number two, a day after your hair transplant, make sure you have something for pain, something for nausea, which will usually be prescribed if you're nauseous after your procedure, and relax, 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 relax. Do not schedule any major event or meeting after your hair transplant. So those are really the top recommendations I have. And also drink lots of water. Don't forget that you need to drink lots of water. That's actually number one. Drink lots of water. If you forget everything, make sure you're drinking. You are chugging on that water. So the next question, do I need pantothenic acid, which is a type of vitamin? after my hair transplant? Yes, so I tend to get this question a lot. A lot of clients or people that have had hair transplants elsewhere, especially out of the country, they tend to call and ask this question about pantothenic acid. Let me tell you something. You don't need that. I'm not sugarcoating it. No, you do not need it. You need your medical therapy for hair loss. That's what you need. If you take pantothenic acid, is it okay? That's okay. But I don't want you to stress out about it. No, don't stress out about it, especially after your hair transplant. And if you haven't watched my video on trash those vitamins, you need to head over to YouTube. YouTube name is Dr. Chevu. I talk about why you don't need vitamins if you're going to get a hair transplant. Okay? So if you've not watched that video, head over to YouTube and go watch it. When do I stop my hair loss medication? Am I going to take it forever? I get this question a lot too. I don't want to lie to you. Now, it's always a gamble if you decide to stop your hair loss medication. Now, if you've had a hair transplant, hair loss is progressive. And if you've been placed on hair loss medication, and now if you decide to stop taking it, the chances are you're going to still have hair loss. But now the transplanted area is going to make it like it's always going to be there. But the other areas that were not transplanted, you are still going to have progressive hair loss. But now there are options when it comes to hair loss treatments. You can take your minoxidil oral, you can take topical. There's so many treatment options now for hair loss. So I don't want you to get stuck in saying, do I have to take this medication for a long time? Let me put this to you now, because most people tend to forget that alopecia, which is hair loss, is also a medical condition, just like hypertension, just like diabetes. And you're not going to say, I'm not going to take that medication. So I want you to think about your hair loss just the same way. You might need to take that medication for a long time. Anytime you decide to stop that medication, chances are you will have progressive hair loss. Next question. It says, how many days do you recommend I take off after my hair transplant? Now, I'm sure you must be new here if you're asking me that question. Anyways, it depends. If you're getting your hair transplant done in the same state where you are, you just need 2 days. Yes, 2 days. And I really, really suggest you get your hair transplant done on a Friday. So you have Saturday, Sunday off. And you can head back to work on Monday. Yes. Now, if you don't want anyone to be in your business, you can take a week off. If you're from out of state or out of the country, I suggest anywhere from 5 to 7 days. Yes. Because you want to fly in, get a hair transplant done the next day, or sometimes most clinics will require you to do some blood tests done. So if that's the case, you might need to have, at least a week off before you head back to work. So it depends. In state, out of the country, yes. Can I still wear my wigs after my hair transplant, and when? This is a big one, especially for my ladies. I promise you, this is like a big problem. Let me tell you something. You can wear your wigs after your hair transplant, but you have to know the right wig to wear and the right time to wear your wigs. And if you haven't watched my videos, head over to YouTube. I have an extensive video about wigs, when to wear it, what types of wigs to wear, and what type of headbands to put on. Yes. So just for clarity's sake, please, before 2 weeks is a no-no. After 2 weeks, you can put on a headband wig. Please, headband wig, no glued wigs. Glueless wigs, but no glued wigs. Please, 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 and please. Okay? So, because after 2 weeks, your scalp skin is healed. Yes. But if you have any redness, itching, or any signs of infection, please talk to your hair transplant surgeon before you proceed to put on a wig. Or you can make an appointment here at Havila Hair Restoration. We can talk to you, and put you through too. So please, anything before 2 weeks is a no. After 2 weeks, you can put on the wig. And you have to know the right wig too. Now, what supplements do you recommend? I do take supplements. Don't get it twisted. I do take supplements, but there's been a whole lot of push on supplements that people tend to forget that hair loss, alopecia, is a medical problem. and they feel that supplements, vitamins can fix their hair loss, please know you need a formal scalp and hair evaluation. Talk to someone that knows what they're doing. Talk to your dermatologist, your primary care doctor, or a hair transplant surgeon, okay, about your hair loss issues. Before you decide to buy all the vitamins you see online, I mean, people claim that it has helped their hair. I promise you, even without the vitamins, if you get a proper scalp and hair evaluation and get on the right treatment, your hair will grow. Your hair will grow, please. Okay? But I'm going to make a separate video on the vitamins that I use. So stay tuned for that. Now, if you've enjoyed this video, if you've watched this video to the end, I'm sure you love what you're listening to. And especially if you're dealing with hair loss and you don't know what to do or where to start from. Do you know where to start from? Make an appointment with us here at Havila Hair Restoration. We offer free virtual appointments, free virtual hair consultation 7 days a week. 7 days a week. So if you say you're busy on weekdays, there are weekends. You can make the appointment for weekends so that somebody from my team will talk to you and get to know what you need and how we can help you. And if you've loved this video or you know someone that's dealing with hair loss, send them this video or tell them to head over to YouTube. YouTube name is Dr. Echefu. I teach you simple tips and tricks concerning hair regrowth and hair transplant. Until next time, bye-bye.